So, good afternoon to every one of you. Today I am going to discuss one of the very important topic in pediatrics, and that is related to growth of a child. Now, how a child differ from that of an adult? A very fundamental question will tell you that the child has got a potential to grow. On the contrary, when he attains maturity at the end of the adolescence, you will find that the potential for the linear growth, the head circumference growth and most of the parameters of growth, they are already being over, and therefore, the child is in a unique position to have this property of growth during this particular period of life. Now, why we are interested in knowing the growth of the child? So, today I am going to discuss in various parts. Today I will discuss only about the normal growth. The next subsequent sessions will tell us about the normal development, the adolescence, the abnormal growth of the child, then the abnormal development of a child and the pubertal disorder. So, various types of disorders and normal aspect of the growth and development will be discussed in subsequent talks. Okay, so today we will discuss about the normal growth of a child. First of all, what is meant by growth? The growth is nothing but a physical increase in size of an individual, of an organ, of the tissues. So, when these tissues they grow in dimensions, grow in size, grow in numbers, we call this particular aspect as a growth of a particular individual. So, the growth is nothing but a physical increase in size, in simple term, which can be measured by various methods, right from say weight, head circumference or by the help of a tape or something like that. Now, what are the factors which govern the growth of a child? We will come to know that the growth is basically or fundamentally controlled by genetic factors, controlled by the epigenetic, that means the factors which modify the functioning of the genes, and the environmental factors. So, these are the three important factors which control the growth of a child. Now, normal growth, whenever it is present, when we see that the child has got a normal growth, it indicates, it testifies that the child has got a normal internal milieu. That means, it indicates a bellwether of a health. Bellwether of a health means the child is healthy from inside and he is getting nurtured in a normal environment. So, assessment however is very important for the growth of the child, because it is a dynamic process from time to time and during various age groups. So, though it is essential, but it also has got some challenges. Unless we know the meticulous method of measurement of the growth, then we can land up with different mistakes, and these mistakes can lead to anxiety in the parents and also can lead to a monetary loss in the child. So, most errors, what the Henry Cohen said, are made by cursory incomplete examination than by due to lack of the knowledge. So, knowledge is there, but if it is not being applied meticulously, we can commit mistakes, and these mistakes can land up with a lot of problems and anxiety and the monetary loss in the parents. So, anthropometric measurement is one of the simple and gold standard method of measuring the growth of a child. So, this is, let us see how this is being done, how, at what age, what are the various parameters being discussed. Now, what is the importance of the growth? Growth, as I said, is a physical change, and when it is testified, whenever the knowledge of a clinician, pediatrician is being tested to find out what is the growth of a child. First and the foremost is the fetal life. During fetal life also, you find that the fetus grows enormously with a fast rate during subsequent gestational weeks, and that growth is not a uniform or a linear growth. It is definitely with a process of slow and accelerated growth, what is called as a waxing and waning growth, and therefore, we must know at what stage of gestation or weeks of fetal life what is the growth of the child and whether it is commensurate with the gestational age or whether there is a lag behind or whether there is a excess of growth, and that can tell us any diseases or any problems which are encountered in the fetus, in the uteroplacental unit, as well as we can also find out the factors present in the mother. Now, coming to the at birth, what is the importance of the growth? From the gestational age, we can definitely demarcate whether it is a preterm baby, a term baby or a postterm baby, but by weight also we can find out whether it is a normal weight, whether it is a small birth weight, whether it is a large for dead baby, and therefore, the weight is an important parameter at birth as well. Same thing is about the length of the child. The child may be normal by length or it may be small, and that will indicate what is the cause of this shortness right in the fetal life and subsequently also. Same thing is the ponderal index. Ponderal index is one of the important parameter wherein weight is divided by the cube of the length of the child multiplied by 100, and if it is more than 2.5, it indicates that the child has got a normal growth. If it is less than that, indicates the child had malnutrition, what is called as intrauterine growth restriction. Similarly, what is the genetic endowment, the parents, whether there is a commensuration with that of the parental height or whether there is a disparity, that also is one of the important factors. Parents may say that my child is small, looking very small, but when you compare with the parents, you will say that yes, this is appropriate for the family pattern, and therefore, the knowledge of growth is very important during that period. Now, whenever there is a healthy baby competition, your knowledge about the growth is very much important. If you know properly what is the normal growth of a child at various age groups, the height and every other aspect, then only you can say that yes, this baby is a healthy baby and is likely to receive a prize for it, otherwise not. Same thing is about at the time of schooling and the sports participation also, the child has to be healthy. The child has to be examined by the school health officer and find out whether the growth is normal, whether the development is normal, whether the child is appropriate, and whether child can cope up with the stress, physical as well as mental, of these various types of sport activities. Puberty assessment is one of the important aspects during which there is a lot of growth spurt. The fast growth is occurring at this particular period, and assessment is very important at this age also. And same thing is for the medical legal reasons. The medical legal reasons, for example, somebody wants to adopt a child and child is so small that not applicable for adoption, or child is premature, or child is having some disease, then growth parameters will tell you whether this child is appropriate for adoption. Same thing is about any violence created against the child, that can also be tested by the parameters of growth, and various say during the period of adolescence also, any violence being created, that can be found out from the knowledge of the growth. So, growth is very important to find out during these various types of activities. Now, coming to the principles of growth and development. Now, we know that growth is a continuous process. It is not that it only occurs in a station wise or in a say stepwise pattern, though it occurs continuously, but it is unidirectional. That means it never occurs in a reverse direction. So, unidirectional growth is a continuous process, and it is also in a cephalocaudal. That means the portion of the head, portion of the trunk, it is growing faster than the portion of the legs and so on. So, this is what is called as cephalocaudal direction growth of a child, and that is very commonly seen, that is very firmly seen in these babies. Now, coming to there are certain periods of age when there is a fast growth, as well as there is a deceleration, as well as there is a plateau. For example, in the fetal life, it is a very fast growth. In the childhood life, you get a plateau phase, you get a slow growth, and mother says that my child is not gaining weight. Then we have to tell her that no, this is the time when the growth is not so fast as you expected during the first 1 year or 2 years of life, and therefore, that knowledge of growth can help you in counseling the mother. Same thing during puberty, there is a growth spurt, and you have to find out whether this child is growing or not, and this is called as a ICP or a Karlberg model. So, a Karlberg model is nothing but infant, that is fetal plus early infancy, then childhood, that means say after 3 to say 5 years or even school going period, and the P is the pediatric or puberty group, when beyond 10 years of age you get a growth spurt. So, ICP model is called as a Karlberg model, and that is how you have got different phases of waxing and waning phases of growth during these phases. Now, growth and development is a concomitant process. It is not that it is occurring separately and this is occurring separately. Both the things go on hand in hand. Only thing, though they are, the development is functional acquisition of functions, the skills and maturity, while growth is a physical increase in size. So, both are occurring concomitantly, and it is controlled, as I just now said, by genetic, epigenetic and environmental factor. System maturation dependency is very much important. Unless a particular system is mature enough, say for example, a child who is only say 6 months old, you can't expect him to stand or walk because his nervous system is not mature enough. So, maturity of the system is very important. Same thing is about the growth of the or the head circumference growth of the child as well. So, different tissues of the body grow at different times and with different rates. That is one thing which one has to keep in mind. This is what is being shown in this particular graph, what is called as the ICP graph or ICP model, where fetal growth is occurring very fast in this particular phase, in this particular slide, and then it is you get a childhood which is slightly slower rate, and then you get again a pubertal period. Now, these three phases, they are controlled by various different factors. You see that the infant is predominantly dependent on genetic endowment and the nutrition and the uteroplacental unit. So, these are the three conditions which has to be very good enough to have a normal growth of a fetus and the infant. While in case of a childhood, growth is more often dependent upon the hormones. The most important is the growth hormone or a thyroid hormone and so on. While the pubertal growth is dependent upon the sex steroid. So, this is how what is called as a ICP model, and depending upon at what time the child had a slow growth or a fast growth, you can determine what are the factors responsible for this particular type of illness. Now, this is different types of tissues growing at different rates, and as I have already said that cephalocaudal, the head, the brain tissue grows faster, as you will see in this particular graph. This is the graph of the brain, wherein in first 2 years of life you find that the growth of the brain is almost achieved as high as 80% of the adult value, and thereafter only 20% of the brain size go on increasing. So, that is what is called as a neural type of growth or a brain and head growth. Then you have got a say lymphoid growth. Lymphoid tissues are intimately concerned with the, say for example, the immunity of a child, and therefore, in smaller babies, as we give more and more vaccination or the child is exposed to many viral infections, the child has to face this particular say problem with the help of a very fast growth of the lymphoid tissue, which are intimately concerned with the immunity of the child. So, lymphoid growth is another one, and you find that before puberty it is almost as high as 180% of the adult value. So, you find that the tonsillar enlargement, the adenoid enlargement, it is very commonly seen in a child below say 10 years of age, because this is a physiological hyperplasia of these particular tissues. While on the contrary, general growth is a sigmoid curve. This sigmoid curve initially in the first 2 to 3 years very rapid growth, then there is a plateau phase, and then there is again a spurt during the puberty. While reproductive growth like puberty growth, it is almost negligible before the age of 8 to 10 years, and thereafter you find that after 10 years you get a sudden rise in the reproductive tissues of the body, say for example, the secondary and primary sex organs. So, these are the different tissues. This is same thing is being displayed in this graph also. This is the graph of brain growth, the somatic growth, the lymphoid growth and the gonadal growth, right. Now, coming to the what are the factors, various factors which control this thing. Now, intrauterine phases, first of all, let us see what are the phases of childhood. Now, coming to the intrauterine phases, you have got a ovum phase, where right from the phase of conception to first 2 weeks, it is called as a ovum phase or egg phase. Then you have got a embryo phase, which starts from 2 weeks to 12 weeks period, where various organs are getting formed during this phase. Any insult to the fetus during this period can lead to significant problem in the development or growth of the various organs, including heart, brain, kidneys and so on, and limbs as well. The fetus on the contrary is a phase when you find that it starts from 12 weeks to say by the time of birth or around at the most 42 weeks. This is the phase when you find enlargement and maturation, enlargement of the various cells and tissues in the body, as well as maturity of the various organs. The organs are not mature during embryo phase, though they are physically getting formed, they are not mature enough, but during the fetal life they are getting matured. Now, extrauterine period, you find that various phases are there. One is neonate in the first month, which is very susceptible age for various types of illnesses and even the neonatal deaths. Then infant age from 28 to 365 days, toddler is between 1 to 3 years, preschool is between 3 to 6 years, and school going is in between 6 to 10 years of age, and then the adolescent, say by 10 to 17 in females and say 12 to 18 years in boys. So, these are the various age groups the child's development or growth is occurring, and the various parameters which are being tested, which are being examined, which are being say measured in childhood is right from first and the foremost is the most important is the weight of a child. Then you have got a growth chart you find, then length of the child, height of the child, length is measured below 2 years of age in supine length lying down, and height in a standing posture, weight upon height ratio or the weight for height that is being also measured, growth velocity is measured, that means the number of kilos or the number of centimeters the child has grown over a defined period of time, that is called as the growth velocity. Then you have got growth charts which are which tells you the longitudinal status of a child's growth, whether the child was, how was the length before, what is now, suppose 1 year old child, 2 year old child, 5 year old child, 10 year old child, whether he is following a normal growth or not, and at what age there was a deceleration, that can tell us the timing of the insult and the probable diagnosis. Then body proportions, upper segment, lower segment, that also we will see, and the stem stature index. These are some of the parameters. Same thing is about the head circumference versus chest circumference ratio, mid arm circumference, body mass index, body parts, even tissues, skin fold thicknesses, dentition of the child and bone age. These are various parameters under which we have to find out the growth parameters of the child to be examined. Now, weight is the most reliable criteria, it is the most say labile criteria, it is very easily measurable criteria, and that has to be done very correctly. In infants it is measured in the fraction of at least 10 gram in the newborn period, subsequently in the fraction of 50 gram and 100 grams. Then in a childhood the weight has to be taken in a fraction of 100 to 200 grams. So, that is how, and this is the Salter weighing machine, and this is a beam scale wherein this is said to be most accurate method for the older child, and this is for a small child. And this Salter method or a spring balance is useful for a community survey of a weight of the population. Now, coming to the length of the child. Now, before 2 years I just now said recumbent length using what is called as a infantometer, and more than 2 years standing height what is called as a stadiometer. So, the formulas are there, various one, to find out what is the normal at particular age plus minus, and in girls around rough rule of thumb is that at 2 years the half of the adult height is attained. That means whatever the height is at 2 years, you double it, that is the expected height at the adulthood. And in boys, whatever is the height at 2.5 years, if you double it, that is the likely height of a child during adulthood. These are the various instruments which are being used. This is called as the infantometer, and this is how the child's foot rest has to be applied firmly, and this is the head end or the head plate which is to be applied firmly. There has to be 2 personnel to take the measurement of this child, so that there are no errors. Same thing is about the height also. The Frankfurt length, Frankfurt plane has to be taken to measure the length of the child, height of the child. Frankfurt length is plane is nothing but the lower point of the tragus and the lower border of the orbit. That plane should be parallel to the surface of the or ground of the particular plane. That is what is called as the Frankfurt plane, so that there is neither hyperextension or flexion of the head, and the child is standing straight ahead, and his scapula is touching the vertical rod or the vertical plate. The heel also should touch the vertical plate. So, this is how the measurement is, and at the end one should try to make the child the head as up as possible, so that the maximum stretchable height of the individual is being measured. Now these are the common errors. You see that the child is away from the foot end or the foot plate, head plate. Here again the child is extending, dorsiflexing the foot, and so therefore there will be error. Here also the child is not holding it properly. So these are the common errors which can give rise to the difficulties in interpretation when you follow this particular child. So correct method of height measurement is saying that it has to be measured without a footwear, heels and back should touch the wall, lower border of the eye socket in the same horizontal plane as external auditory meatus, looking straight ahead, and a right angled block slides down until it touches the head of the child, and gentle but firm pressure upward applied to the mastoid from underneath and record to the last 0.1 centimeter. So that is how the exact method is to be followed, so that there is no errors. And these are the certain errors. The child is now in a reclining position, is not properly straight ahead, standing straight, and these are the different types of errors with which either extension of the head or the flexion of the head which can make the errors. So that has to be avoided. Now coming to the head circumference, brain growth is rapid during infancy and it is unaffected by mild to moderate degree of malnutrition, because brain is the one organ which takes up maximum amount of oxygen, maximum amount of blood flow and maximum amount of nutrients during the early part of the childhood, and therefore whatever is deficit is there, it is little bit affected, least affected. But if it is severely being deficit for a long period of time, then again the head circumference will get affected. So marasmic children will have relatively large head compared to body size, then should not be measured within 24 hours after birth, because during, say for example, vaginal delivery there is a overlapping of the cranial bone, and therefore head circumference may be little bit erroneous. And bony landmarks like superior orbital ridge, anterior and external occipital protuberance, these are the landmarks, what is called as occipitofrontal measurement, that has to be taken while measuring the head circumference. This is what is the tape being used, and these are the non-stretchable plastic tapes which are being used, and you get a reading over here, and that has to be taken as the correct method. So at birth you find the length, head circumference is in between 33 to 35 centimeter, and by 3 months it becomes almost 40. So there is a gain of almost 5 centimeter, and by 1 year it becomes 45. So there is an addition of 10 centimeters in the first year of life. At 2 years it should be somewhere around 47 to 48, and by 12 years it is 52 centimeters. So this is how the measurement has to be there, and has to find out whether it is corresponding or not. Now chest circumference is similarly, chest circumference at birth is more than that of the head circumference. By 1 year it equals, and thereafter the chest circumference becomes more than that of the head circumference, nothing beyond that. Now coming to the fetal growth. Now fetal growth, you know that in the first 20 weeks there is a stage of cell division. That means there is a hyperplasia of the individual cell. From a single cell ovum, it go on multiplying, and that is called as a phase of hyperplasia. And from 20 to 28 weeks there is a stage of hyperplasia plus hypertrophy. Now the cell becomes swollen, and from 28 weeks to term you find that there is a stage of hypertrophy plus maturation of the various tissues, various cells, various organs, and that is the time when the any insult, if it occurs, that can lead to the functional problem in the particular child's organ. Now this is how it is being classified. Any child who is born before 37 weeks is called as a preterm baby, below 37 weeks. A term baby is when it is born after 37 weeks, and late preterm is the one in between 34 to 36 weeks gestation. So this is what is called as late preterm baby. Okay. Now fetal growth is not uniform, and in the first say 16 weeks period you find that the growth of the child is in terms of grams per week. If we find only 10 grams per week is the only growth during the first 16 weeks, then thereafter you find that during the next say another 12 weeks period you find that there is a 85 gram per week addition, and subsequently that is the phase when there is a hypertrophy as well as the phase of maturation of the organs. You find that there is a almost 200 grams per week growth of the fetus tissues, and thereafter again it goes on declining and to 70. So, it is not a uniform, it goes on increasing and subsequently declining. So, growth velocity is faster, go on increasing and then decreases towards the end of gestation. Factors controlling fetal growth, as we already said, genetic, maternal, placental and fetal, these are the various factors which control the growth of the fetus. The genetic endowment, say for example, child is being born to a parents who has got some genetic disorder, then their growth will not be normal. Maternal factors like severe anemia, severe malnutrition, underweight, short stature. So, all these factors will give rise to a smaller child. Then maternal, say for example, hormonal problems like say diabetic mother, the child will be say large for date in that case. The placental factors like say small placenta, or say for example placenta previa, or there is a uteroplacental insufficiency, or there is a say hypertension in the mother during pregnancy, gestational hypertension, that all will lead to a interference in the growth of the child and will lead to intrauterine growth restriction. Now, fetal factors, fetus himself can be at fault, say for example, a child who has got some genetic disorder, for example, number 1. Number 2, at multiple gestations like twins or triplets, they will have definitely sharing of the nutrient and definitely and the blood flow, and definitely they will have a smaller size at birth. So, these are various factors. Now, uteroplacental unit is very much important during the fetal life to promote the growth of the child, and that is how it does. It does by giving optimum oxygen, optimum circulation, optimum say excretion of various excretory material, then providing nutrition right from glucose, amino acid, fatty acid and the various hormones being produced by the placenta that can promote the growth of the child. So, these are the various factors which, and the hormones which control the growth of the fetus, they are not the say growth hormone predominantly, but it is the insulin or insulin like growth factors or insulin like growth factor binding protein. These are the one, human placental lactogen, leptins which promote the growth of the or the addition of the fatty tissue in the body, and the epidermal growth factor. These are the ones which control the growth and weight of the fetus during fetal life. Now, this is what is being already said. Preterm baby is born before 37, term baby is between 37 to 42 weeks, and post-term after say 42 weeks onwards. As in terms of weight of the baby, small for date when the weight of the baby is less than 10th percentile of the expected one, then it is called as a small for date baby. Appropriate for date when it is in between 10 to 90th percentile, and when it is more than 90th percentile, then you call it as a large for date baby. Say for example, a baby born of a very large size mothers, number 1, or a baby born to a diabetic mother, there you get a large for date babies. Now, coming to the newborn baby's weight normally should be 3.4 kg and range may be from as low as 2.5 to 4 kg. That is what is the normalcy we can take into consideration, and the length has to be somewhere in between 48 to 52. Average is 50 centimeters. Head circumference similarly is 30 to 35 centimeters. That is what is the normal growth profile of a newly born baby, a full term baby. Now, after delivery 10% of the birth weight is lost, and that is because of the excess amount of extracellular fluid with which the baby is being born, that gets initially lost, and therefore, the baby has got a loss of weight. But the birth weight is regained by the time the baby is of 10 days old. Then thereafter you find that the baby weighs 200 grams per week. They go on increasing 200 grams per week, and in the first 3 months, that comes to the average of 30 grams per day, and thereafter you find that the baby velocity becomes less, and therefore you have got 150 gram per week, and that is in the second 3 months period, that is 20 grams per day, and in the last 6 months of infancy, the weight gain is only around 50 grams per day. So, that is how the velocity go on decreasing. Now, during infancy what happens? The weight of the child increases as I already said in the first 3 months, subsequently in the first year. At 3 months of age, the weight of the child becomes birth weight plus 2 kg, and by 4 to 5 months of age, the birth weight becomes double, and by 1 year it becomes triple, and by second year it becomes 4 times. Now, height of the child is again increases by 2.5 centimeter per month up to 6 months of age. Thereafter 6 months to 1 year 1.5 centimeter per month, and at 1 year the height of the individual is on an average 75 centimeter. The head circumference similarly I already said, chest circumference I already commented. Preschool period. Now this is the period when the growth velocity goes on decreasing and it is in the plateau phase. The weight increment is only 2.5 to 3 kg per year, and that lasts up to the age of 10 years when pubertal spurt occurs. Height also same thing, 10 centimeter in the second year and only 6 to 7.5 centimeter from between 3 to 10 years of life. Head circumference again similarly same thing, 3 to 4 centimeter in second year and 2 to 3 centimeter in the third year. Chest is more than head in second year, and if less indicates again a malnutrition. Now school going period, what happens? The growth slows down after the second year, and weight gain is only 2.5 kg per year and height gain is only 5 to 7 centimeter per year. Head 2.2 to 3 centimeter are added during the whole period of the up to the adolescence. Now during adolescence what happens? 10 to 16 years in girls and 12 to 18 years in boys is considered as a normal period of adolescence in childhood. The puberty onset of menstruation in girls occurs by 11 to 14 years. Average is in between 13 to 13.5 years. It is a period when there is a growth spurt, and therefore there is an acceleration of the weight as well as height during this period, and starts by 10 years in girls and around 12 years in boys. Now 50% of the adult weight is added during adolescence itself, and 25% of the adult height is being added during the adolescent period. Sexual dimorphism in females as compared to the male, what happens? The growth profile, the height of course already commented, the body mass index, in the female it is 19 to 25, because the females they are shorter one, they have got more of fat deposition and therefore their BMI is slightly more during this period as compared to the male one, and their pelvic diameter is more than that of the shoulder girdle. The male has got a more of a wider shoulder girdle. The fat is more in females as compared to the male, lean body mass is more in the male, and RBC and hemoglobin mass is definitely more in male adults. Now coming to these two curves, what are these two curves? One is called as, this is called as a distance curve and this is called as a velocity curve. Now distance curve tells you a cumulative increase in the weight and height of an individual, and that tells you whether your reference child is closer to this graph or whether it is away from the graph. If it is less, then indicates a malnutrition. Same thing is about the velocity also. Weight formula I already said, simple weight calculation I already said, normal height I already said. Rate of growth I already said. In the first 1 year of life you find that the increase in length of the child is almost 24 centimeter per year, and increase in head circumference is to the tune of 2 centimeters per month in first 3 months, and thereafter 1 centimeter per month, and thereafter only 0.5 centimeter per month. Thereafter you find that there is only 5 centimeter per year increase in the length of the child by the age of 4 to 6 years, and peak height velocity occurs during adolescence, and in male you get almost 10 centimeters per year increase in the height, while in females it is around 8 centimeters per year. Growth charts, why we need growth charts? It is of value to have serial record of a child's height. Okay? Periodically on a growth chart, what is called as road to health chart, which is based on the percentile curves, we find that the reference child is falling closer to this growth, normal growth, or whether it is away from. The flat curve or the growth flattening indicates a slowed or arrested growth of the child, which must alert the pediatrician. That is the early way of knowing whether the child is not doing well or whether child is behaving normally. Say for example, a child of congenital heart disease, he is being operated at the age of 3 years. Up to 3 years, say for example, his weight was just the 10th percentile. After operation, we expect that he should progress towards the 50th percentile. But if we find that no, even after operation he is not doing so well, indicate that there are certain other interfering factors which are interfering with the growth of the child. Now growth charts are very much useful, and it gives a tangible and visible attribute of what is the growth of the child. It creates a felt need, demand for growth. It detects the earliest sign of faltering of the growth. To reinforce effective behavior resulting in growth is also important aspect of this growth chart. To illustrate the adverse effects, for example, infection. For example, child who is operated, he has got some other infections, for example, urinary infection, or he has got tuberculosis underlying, or mental deprivation, then he will not have a good growth of the child. To facilitate counseling, to mother regarding the growth is, the growth chart is very important, and the growth is primarily meant for the mother to visualize and motivate concern for healthy growth in her child, because it gives a visual idea about how the child is doing. These are the various growth charts, the CDC growth charts. For the blue one are the male charts and the red one indicates the female charts, and this is the topmost is a height chart and this is the weight chart, and you find that this is the x axis shows the age of the child at various age groups, how he is doing. So, this is what is being mentioned. Now, the weight for height, this is one parameter which is being assessed in a child who is short. Say for example, a child who is say 4-year-old and his weight is say 13 kg or 14 kg, then 13 kg and the height, say for example, this 4-year-old child is say 90 centimeter, and then in that case we will see that for this 90 centimeter how much the weight of the child is lagging behind. If that is severely lagging behind, then we call this particular child as a stunted child. So, value below 90.5% indicates malnutrition and value above 120% indicates overweight or obesity. These are again the growth velocity charts which already mentioned. This is the velocity which is declining rapidly after infancy, then there is a plateau phase and then there is a growth spurt during puberties. Now, coming to the age independent factor, many times mother does not know the exact age of the child, or child is say for example unconscious, but there are no parents and you have to find out what is the growth of the child. In that case, some of the age independent parameters are to be taken into consideration, and that is called as a body ratio. Now, upper segment lower segment ratio, that is has to be found out, as we have now just now said that cephalocaudal direction is the growth principle, and therefore, upper segment is always on a higher side in the early phase, and therefore, at birth you will find that the upper segment lower segment ratio is 1.7, and at 3 years it is 1.3, at 4 years it is 1.2, and at 10 to 12 years it is 1:1. So, this is how the growth of the child go on, the lower segment go on increasing faster than the upper segment. Same thing as about the stem stature index, this is nothing but a ratio of sitting height with the length of the child. Arm span is another important attribute to know any problem in the child. Say for example, distance between the tips of the middle fingers when the arms are outstretched, it is equal to the height at 10 years of age, but below that the in early years it is 1 to 2 centimeter less than the height or length of the individual, and after 12 years, that means after puberty, attainment of puberty, it is 1 to 2 centimeter more than that of the height. So, arm span becomes more after puberty and less before puberty. So, this is what is the mention, and this is one of our patient who has recently come, just a day or 2 days before. You find that this child history was that the child was floppy in early years, he was not very much mobile in between, and now he has got recurrent respiratory infection, and when I examined, I found that the child is tall enough, but weight is very much less, and when his span was measured, it was found that the span is also more than that of the height, and he is just a child of 9 years old, and 9-year-old child where the height by arm span is 0.9 indicates that child has got a marfanoid appearance or marfanoid habitus, and when his throat was examined, there was a high arch palate, and child also has got a arachnodactyly, child also had a flat feet, a long feet, and so he was to be considered whether to have a Marfan syndrome, and he needs to be followed up. Presently, he did not have any murmur or cardiac thing, neither he had any visual problems at this moment, but these are the ways we can find out. Now, mid-arm circumference is another method of knowing the malnutrition, and this is being measured by the non-stretchable tape. Normally, it is more than 13.5, it is usually done in a preschool child between 1 to 5 years of age. When it is less than 12.5, indicates severe malnutrition. So, this is how the Shakir tape is being used for the mid-arm circumference, and if the mid-arm circumference lies in this particular red zone, it is called as that the patient has got a severe malnutrition, 12.5 centimeter. If it is falling in this yellow belt, then it indicates that the child has got moderate malnutrition, and if this is falling in the green zone, it indicates it is a normal one, so more than 13.5 centimeter. Bangle test is another crude method of knowing or assessing the nutritional status in the community, and it is made up of a 4 centimeter bangle, and if it say can be negotiated across the elbow, it indicates that the child has got a severe malnutrition. Quack stick is another same method which can tell you whether there is a malnutrition or not. Skin fold thickness, this is done by measurement with the Herpendon's caliper over the tricep area and over the interscapular area or subscapular region. Now, it gives an indication about this subcutaneous fat and indirectly the caloric reserve in the body. So, that is there are various norms for or the algorithms for nomograms for the this particular measurement, and you can refer it to them and find out whether the child has got a normal fat or it is malnourished one. So, the various areas which are measured are tricep skin fold thickness, subscapular skin fold thickness and mid abdominal circumference. So, these are the various measurements which are to be taken. Upper segment, lower segment already said. Mid parental height is also to be taken into consideration when you are assessing a child who has got a short stature. Kanawati index and the other ratios they are there. They are again the age independent criteria to find out the child's whether has got a malnutrition or not. Quantile index already being referred. Now coming to the body mass index. Body mass index is another very important in day to day life use parameter to know whether the child has got a malnutrition, normal nutrition or a obesity. So, normally child has got a, should be having a 18.5 to 25 body mass index. Body mass index is nothing but a ratio of weight in kg multiplied by say height square in meters. So, if you take the measurement and you find that if it is between 18.5 to 25 it is normal, but if it is less than 15 indicates moderate malnutrition, and if it is less than 13 severe malnutrition, and more than 22 overweight and more than 25 again indicate obesity. So, this is what is the importance of body mass index. Dentition, it is not a dependable parameter, it is just like a politicians, anytime they can come late or early and they can go away at any time. So, it is not a dependable parameter, but on an average it starts erupting by the time of 6 to 7 months of infancy. Then the rest of the milk deciduous and temporary teeth appear at the rate of 1 tooth every month. After every month, every one more teeth go on increasing, and by the age of say 2.5 years, all the 20 teeth set is being well formed, that is called as a primary dentition. This is what is the this thing. Now coming to the permanent dentition eruption sequence, the central incisors, they are the earliest they are the second one to appear. Earliest to appear is a first molar, that is the one 6 to 7 years, that is the one which appears first. Then comes the central incisors, lateral incisors, canines and so on. The second molar, the importance of second molar is that by 12 to 13 years, by the time the girl child has got the second molar erupted, she already has started menarche. That is the indirect method of knowing whether the menarche has been started or not. And the third molar, and if it is not being started, then indicates that there is something abnormal in her say pituitary or the hypothalamo pituitary gonadal axis. So, that is one thing which is very important about the second molar teeth. Third molar usually occurs erupts after 13 years of age, 17 years of age. Now, bone age. Bone age is useful to assess the maturity of a newborn, especially in some medical legal situations. Say for example, somebody says premature baby, then you find out whether the center for the tibia and the femur, upper end of the tibia and lower end of the femur, whether that is appeared or not. If it is not appeared, then it is indicative that this child is a premature baby and so on. So, even if baby has got a hypothyroidism, the centers may not appear. So, the areas of bone age estimation, birth to 3 months you have to knee and ankle is that is the one. Then shoulder is the bones of the shoulder has been x-rayed by 3 to 9 months of age. Hands and wrist from 1 year to 13 years of age, and elbow and hip by 12 year to 14 years. These are the centers at various ages to be seen. The reference has to be given to Tanner and Whitehouse scoring system or a Grulich and Pyle atlas, and there are certain ready-made atlases available nowadays, digital atlases by which you can compare them. Now, bone age radiology, X-ray of the knee and hip file centers they are present, that I already said. Last but not the least is growth statistics. What is meant by growth statistics? It is being said that medicine is a science of uncertainty and art of probability, and therefore certain figures, certain values has to be remembered. One is mean, that is the average of the total say values or total entries or the frequencies which are being measured. Median is the center of the population, 50% below and 50% above, that becomes the median. Mode is the largest number of the persons having the same value, that becomes the mode. Standard deviation is the degree of dispersion from the mean. That means this is the suppose the mean value, any deviation from this either way is called as a standard deviation, and the observations indicate 1 standard deviation, 2 standard deviation, 3 standard deviation, like that. More away from the mean, more abnormal the child is. If it is on a lower side, indicates malnutrition, underweight, short child or whatever it is. If it is on a higher side, it indicates obese child, tall child or whatever it is. And the another parameter which has to be taken into consideration is the percentile and Z score. Percentile is nothing but the rank of a child. Suppose you have got 100 students in a classroom, you arrange them chronologically as per their weight or as per their height and arrange them serially, you will find that suppose the 50th child, that means in between, will be the average child, and that is called as a 50th percentile. If a child, reference child, is coming across or coming parallel to the say 3rd or 4th percentile, then that particular child is said to have a 5th percentile or 4th percentile rank of that particular system, that means weight or a height system. Z score is another newer modality of comparison. Now, this is what is the percentile chart. This is the 50th percentile with which the child has to follow the weight, height or whatever it is, and then if it is on the higher side indicates more, if it is lower side it is the either the child is underweight or short child. Last but not the least is growth is a unique attribute of a child. It's a very unique say endowment of a child, even that applies to the animals also, and it starts from womb to the maturity, and birth is merely one station. It is not that it starts from birth, it starts before birth, and from womb to the maturity it is a continuous process, but with certain waxing and waning phenomena. Several factors control and interfere with the growth. Normal growth is a bona fide evidence of normal internal and external milieu. That means the environment, internal as well as external milieu, is normal. Growth assessment is warranted from time to time because it is variable with normal age groups as well as with certain diseases underlying it, and normal growth is reassuring to both parents and physicians alike. So, thank you once again. 2 gifts are we should offer to the children, and what are those 2 gifts? They are, one is roots and other is wings. Let them prosper as per their potential to as much as possible, and thank you once again.